the international arena cannot solve this problem alone. We have to be realistic. There are things that must be done in domestic jurisdictions. There are things we must do in our countries. And I will explain. For example, a matter that was ably canvassed by President Lorenzo about health. It is true. There is a relationship between poverty and conflict. There is a relationship between health and development. And as a result, it's become increasingly clear to us that even in the context where global resources, global fund resources, Gavi resources are going down, we must step up domestically mobilized resources to fill the gap. This is what we have done in Kenya, for example, so that we're not just discussing about reform of the international global financial architecture. We are also discussing reform of our own domestic raising interventions so that we have resources that is available at the domestic level. Just allow me just to say this, because it's important to contextualize where we are. For example, in Kenya, even when global resources were dwindling, we stepped in with domestic raising resources. We changed the infrastructure for raising health insurance from where we had 0 point something percent and the poor were paying 10%. We agreed on a standard 2.75% for everybody to pay. What has happened? We have raised $1 billion, money that we didn't have, and we have raised it domestic, using domestic resources. So some of the interventions can be sorted out by looking at domestic raising interventions that are local in its nature. Let me also say this. We've also leveraged on the private sector to provide help in Kenya. We worked with manufacturers that were buying from, we were buying from them equipment for our hospitals. We decided to change it on the other side. We decided to create an investment out of equipment. Now manufacturers are investing. We have now a leasing program, a fee-for-service program, where manufacturers, where we were buying a CT scan or an MRI for our hospitals, today they bring the MRI to the hospital, they bring the CT scan to the hospital, and we pay for service. For every service we get, we pay for it. We don't have to pay for the equipment anymore. So we have changed. Instead of us investing in buying equipment, manufacturers have seen an investment opportunity for them to put equipment in our hospitals, and it comes out as a win-win. So the private sector and the public sector are collaborating to deliver on public interventions. As a result, we have mobilized close to another $1.5 billion from the private sector to fund our health delivery mechanism. So there is what can be done globally, and we are all in for making sure that there is proper interventions in making sure the international financial architecture have proper representation and voice from our continent, but also we will step up as countries on local solutions because we cannot wholly depend on external solutions to meet the challenges that face us, whether they are financial or they are public in nature. So